I met Dr. Safran about a year and a half ago when I was to have the treatment with chemotherapy. I had pancreatic cancer.
I like to treat cancers that others have found very hard to treat. And I try to make treatments that are not too toxic, that not only shrink people's cancers, but help them to feel better.
I met Dr. Safran shortly after I had surgery to remove my tumor. I had read about the clinical trial that he was offering, so that's really what caused me to become his patient.
BrUOG began about 2 decades ago. We all had a desire to do great clinical research, but to be successful, you have to have a large network. None of the hospitals individually were big enough to effectively do clinical trials. So all of the hospitals affiliated with Brown University got together, and we decided we'd have a central office at Brown, and anyone with a Brown academic appointment could write a study. This study would be run through our office at Brown and then went to the FDA to be approved, and then we would distribute it to all of the Brown hospitals where patients would be treated.
There was no way I was going to Boston for treatments when we have a wonderful college, Brown University Medical School, and all the research being done here.
I certainly knew of Brown's excellent reputation. That was another aspect that caused me to seek out a trial here.
The standard treatment for stage 3 lung cancer, which is locally advanced lung cancer using a combination of chemotherapy and radiation, was developed at Brown University Oncology Research Group. That treatment is still used today throughout the world. One of the contributions I'm most proud of is we found the importance of the HER2 new gene in esophageal cancer. We were the first institution in the world to pilot the use of an antibody directly to target the HER2 new gene. There then became a national phase 3 study where approximately 580 patients across the country were treated to determine whether the drug trastuzumab was important in esophageal cancer. One of the things I'm most excited about is next year the results of that study should be known.
My whole experience, it's been very eye-opening, very rewarding in the fact that they've done a cure to this point. Everything has been explained. Everybody has been fabulous.
I love being part of the patients' lives. You get connected to them right from when you meet them, and you share their life with them. We continue to do cancer studies that have important impact, not only within the state, but across the United States and even across the world.